This episode is brought to you by Roundtable Group, the experts on experts. We've been connecting attorneys with experts for over 25 years. Find out more at roundtablegroup.com.
Welcome to Discussions at the Roundtable. I'm your host, Noah Ballmer, and today's guest is Dr. Nasser Heyrani. Dr. Heyrani is a Harvard Fellowship-trained, board-certified orthopedic surgeon. He is a published contributor to several academic studies, a speaker for national conferences on stem cell regenerative therapies for orthopedic injuries, and an expert witness. Dr. Heyrani holds an MD from UCLA. Dr. Heyrani, thank you so much for joining me here today at the Roundtable.
Thank you, Noah. Thank you for having me. Pleasure to be here.
Absolutely. Let's jump into it. So you're an established medical professional, obviously, but a newer expert witness. How did you first learn about expert witnessing, and how did you become involved?
Well, I guess I first found out more from people reaching out to me. I'm several years now out of all my long training that I've had. The road to becoming an orthopedic surgeon after college is about 15 years if you take into account all the residency, fellowship. I did an extra year of research in the middle of my residency. And then as I got out, I kind of slowly, I would say, dipped my feet in the water in the med legal scene. Initially just doing qualified medical evaluation work in California. And then that kind of reached out to establishing relationships with attorneys. And then I got asked to kind of provide my kind of unofficial opinion with some of my colleagues that are attorneys. And then that became a little bit more established into real expert witness work.
Qualified medical evaluator. Tell me about that.
So in California, the way it works is if you have a workers' compensation case that becomes, litigious, where you have the defense and the applicant side filing the claim. A qualified medical evaluator is someone that gets picked. You have to be certified. There's an exam you have to take. Not every person can do it, but you basically get listed on a panel specific for your specialty. So you can have it from psych to internal medicine to whatever specialty. Dentistry, for example, also has it. Obviously, orthopedic surgery is one of the more popular ones because a lot of work-related claims are musculoskeletal in nature. So you get picked kind of at random through the state of California, and you get asked to really be the referee physician on the case, where you still perform an examination, but your job is not to treat the injured worker. Your job is to provide your medical expertise or your medical opinion on what's going on with the case. So that's really how I got introduced to it.
That sounds like it's not so different than the vetting process, like maybe a more extreme case, but it's not so different than the vetting process that expert witnesses go through, right? You have to be an expert in your field. You may be challenged on that through a schema that we call the Dobert system, although California is still a FRI state, so it's a little bit different for people who are familiar with the different standards that experts must be an expert and must be able to prove that, and that their expertise is not only general but specific to the fact pattern, all of that kind of stuff. But ultimately, you are a neutral person. So it sounds like it is a similar situation to that sort of challenge that you were just mentioning. Let's talk about that vetting process a little bit. So you've gotten these calls from attorneys. How does that go, and how does that gel with your expectations?
So typically, it starts with a conversation. They can, whether it's an email introduction where they tell you the specifics of the case. Obviously, if they're representing the applicant side or the defense side, I do work on either side of the spectrum, and they tell you specifics of the case. How obviously the timeline is important. If it's something that needs a quick turnaround, you want to make sure you're available. I have a busy private practice of my own where I'm seeing patients actively treating, which obviously helps being an expert. If you're out there treating patients in the real world, it makes a difference. And then they kind of tell you the specifics of the case, right? Obviously, everyone has their own agenda when you're an attorney, as I'm sure you know, when you're representing your client. And it's, I would say, more of just a preliminary call where I kind of give them my unofficial, I would say, opinion, just based on what they're telling me without delving too much into the medical records. And I say it's something that I feel comfortable that's within my domain. And sometimes it's telling them, hey, this is something that I either don't feel comfortable or it's beyond the scope of my area of expertise. If it's something that I feel is not necessarily black and white where I would feel comfortable defending it or being involved in the case.
Do you feel that you have to take a proactive approach in asking the right questions to figure out if you're the right person for the job, or do attorneys typically provide you all of the information that you need in order to make the determination of whether or not you should accept an engagement?
I would say that it varies by the attorney. You have obviously just the same way that I'm relatively new to this arena. I'm not a seasoned vet by any stretch of the imagination, but you have attorneys that have been doing this for a long time, and they've done a lot of it. A lot of them have extensive medical knowledge because they've been doing this for a long time, and they've learned from the surgeons that they work with the same way that I learned the legal side of things from the attorneys that I work with. So some of them paint like, there's really no other questions that I need. I say, yeah, absolutely. I feel comfortable stating my opinion on this. A lot of the times they don't necessarily know what they don't know, right? Which is why they're reaching out to you. And at that point, that's where I'll kind of ask some of the appropriate questions without getting into specifics of any specific case. But
Sure.
It's kind of like a dance that you have to have when you're working with attorneys, because the reality of it is attorneys have I would say a little bit more experience. I would say probably in law school or when you come out, whereas I don't think you're obviously aware of the med legal side of things when you're in training. And I'm only 4 years out of my training. So you don't really learn. I mean, you realize you could get sued, I guess, from a malpractice standpoint as a surgeon or as a doctor. But this is like a whole new side of the pillow, I guess, that you get exposed to when you come out. You don't really have any experience with. So, it's definitely a learning curve.
Absolutely. What are some of the strategies that you can employ, or that experts in general can employ to be ready and have some idea of the legal framework that they're going to be in? Do you do outside research? Do you talk to other expert witnesses who have done it before? Do you get it through the attorney? What are your strategies?
I would say it's a combination of all of the above, right? I would say one of my, I like to read a lot with just in general philosophy, business, and I think it's Henry Ford who he basically says anyone who thinks they're an expert, he kind of would avoid working with them. Now, obviously, there's a marketing point of it because you have to be open-minded. I think with a lot of these cases, I went into medicine or surgery because it's the truth is, if somebody falls down, their bone is shattered. There's no denying the fact that their bone is broken, right? Or their bone is fractured, they have a bad injury. But you can also see how now with technology is improving, MRIs are more readily available. I guess it becomes easy to kind of paint whatever picture you want, right? And your job is, I think, the medical side of some of these cases is to just kind of provide the voice maybe of reason or voice of science, because the other people don't have the experience or knowledge that you do in that, and really bringing your clinical experience to this. So I've definitely relied on people who have been doing this for a long time, like the same way that if I was approaching a tough surgery that I hadn't maybe done ever or done in my residency, but it's been a few years since I've done it, the same way that I call my mentors and I ask them, hey, what are some pitfalls that I should be aware of? I think it's the same thing with this, to build a network. And the more you do, obviously, that's a little bit stronger of a network that you reach. Obviously, I go and I read a little bit more. It kind of is an opportunity for me to, if it's a clinical diagnosis or a clinical scenario that I haven't dealt with in a long time, or I've dealt with, but I'm trying to learn more. It's going and reading outside literature, more case studies, to kind of being aware of it. And then really kind of having a discussion with the attorneys. That's the nice thing about the expert witness side of things, where you can have communication with the attorneys, whereas the QME process that I was talking about before, that's considered expert, communication. So you don't really, you can't really talk to the attorney because it has to be fair. You have whatever communication you're having, the applicant and the attorney, the defense side, need to have the equal opportunity to speak with you through a deposition usually. Whereas with this, you can kind of have a little bit more of an open discussion with the attorney and say, hey, this is what I think is going on. And they can educate you on some of the legal aspects of it as well.
One of the things you had mentioned is there is kind of a changing technology. There's new things that are happening all the time. Obviously, you're in the medical field. How do you stay abreast of all of that? And what happens when you're a published author, your opinion has been in medical journals, and you're a public speaker as well? What happens when something changes? How do you deal with the possibility that you might be impeached on the stand on something that you said that you've changed your opinion on, or just the science has moved along? How do you keep track of that, for one? And how do you stay abreast of what's new for the other?
Yeah, I mean, it's you hit the nail on the head, right? I think I can't quote the specific numbers, but like 50, 60 years ago, the amount of time it took for medical knowledge to double would take years, for example. Now I think it's minutes or days. There's constantly new information that's
Wow.
coming out. It's crazy because there's more journals. Obviously, you can do a wide critique of academia. A lot of In order to kind of go up the academic ladder, you have to get published. So it's like how much of what is getting published out there is actually useful.
Hmm.
Things that are getting published to kind of paint either side of whatever argument that you want to make. So I think for me, it's trying to obviously stay informed, but not kind of be drowned in the new knowledge that goes on.
Right.
I don't think it should be a critique that your opinions have changed. Obviously, you don't want to be saying one thing and then another just to kind of support either argument. If you are have a certain opinion that I usually believe that if I see these changes, for example, on an MRI study, it's usually indicative of this, and then you flip flop. I think that's different than, well, actually, now that we've learned a little bit more about this clinical diagnosis, for example, I do believe that this is supported. I think you have to constantly be learning. That's part of your job as with anything that you're doing. Even if you think, like you said, you're an expert at something, doesn't necessarily mean you shouldn't be challenging your opinions and constantly learning.
Let me ask you this. So there's an expert usually on both sides, and they will have typically differing opinions if the attorneys have hired somebody who's going to help their case. In something like a medical action, something like if you're an orthopedic surgeon and there's an orthopedic surgeon on the other side, how can you both simultaneously be neutral but come to different medical conclusions?
Well, it's different. I guess there's different ways to skin a cat, right? There's different philosophies and in what you believe. And I think oftentimes if you have 10 orthopedic surgeons, you're going to get kind of a 50-50 split on, let's say, something that's not legally related, just medically related.
Sure.
Whether should this have had surgery or should this not have had surgery? It's not always black and white. Sometimes it is, right? Sometimes it's like, or even to make it more straightforward, a tumor that's going to kill the patient if you don't take it out. From an ethical standpoint, obviously the patient has a right, but from a medical standpoint, I would say most people would agree, yeah, you should probably take that tumor out. It becomes a little bit more, I guess, contentious when you have things that, again, data may support it one way, data may support it another way. We're all a product of our experiences. Where you trained, your clinical judgments are often the patient interactions you've had, right? If you've gotten burned with doing certain things one way, then you may kind of be on the other side of the spectrum. And you see that and that's the beauty of training and residency, was you get to kind of sample different flavors. And then when you come out, you're kind of, I would say, an amalgam of every other experience that you've had and mentors that you've learned from across the way. And that's really, I guess, when you're involved in a med legal case, really just providing the rationale, right? Explaining in layman's terms, the stuff that is kind of second nature to you is not second nature for the jury or for the attorneys or for the judge, everything else. It's really kind of just being a teacher, right? Which is what the word doctor actually means, teacher,
Mm-hmm.
in Latin. So it's really teaching people where your opinions are coming from, and leaving the rest for the legal side to figure out.
One of the things that we were talking about was, keeping track of everything that you've ever said on the internet, which is something that everybody has to deal with these days. But as an expert
Yeah.
witness and as a medical professional, do you use social media? And if so, what are the pitfalls for expert witnesses, really, and doctors when using social media? Are you careful about making sure that things are private, or being careful about the way that you express certain things, in case that may come up during a test, a deposition or cross-examination?
Yeah, I'm not on social media myself personally. I go on Twitter every once in a while. I like commenting on sports injuries. Sports are one of my passions. So at my Twitter page, I'll talk about, so-and-so, injured his ACL, and I'll give my opinion. I'm very careful about everything else that I put out there, for those same reasons that you mentioned, right? Everything is, you're one click away from having something inflammatory posted about something that you stated or something that you didn't state. So at the same time, it's very hard to not market yourself, right? I would say most of my referrals right now are coming from people finding me through word of mouth, whether it's through Google, Yelp. It's amazing how everyone's kind of Googling their doctors now. So if you have inflammatory stuff about you, then it's really easy to kind of turn patients away. But at the same time, I think you have to have a voice. I don't think you should be, if you have certain opinions, obviously you can have a disclaimer saying these are my medical opinions. This is not medical treatment advice that I'm getting. But I think it's just, at least one of my principles in life is if you're honest all the time, it just makes, you don't have to worry about anything, because whatever you said, you've been honest. So I don't know. Maybe I'm a little too naive and not jaded yet for that, but I think that's usually the best way to go about it.
You've mentioned several times about contacting your mentor and people showing you the ropes and having a good support system in place. Can you tell me a little bit about that, and whether or not the expectations that you had after speaking to these people were met when you first got involved in expert witnessing? Was it pretty much the way they said it would be, or were there some things that kind of threw a little bit of a curveball at you?
I would say both, right? I think one of the first things I learned is you have your teachers, right, that teach you in school, and then you have the real world that teaches you. And the only way to get that is to go out there and start doing it yourself. So everything is a little bit different. I think somebody could warn you, the first time you get deposed, for example, or you deal with a tough case where your opinion is maybe hurting the other side significantly. You have to be prepared to deal with that. But there's only so much, right? It's like kind of being thrown into the deep end at some point. It's good to be aware of that, but sometimes the only way to get just with surgery, you go through, after medical school, it's 6 years of residency, 1 year of fellows, it's 7 years of doing surgery, but somebody is always there, whether it's, a junior resident that's helping you, or an attending, or a senior surgeon. So when you go out there on your own and you kind of get stuck in that, oh my gosh, this is a tough case and there's nobody here that I can call, I gotta get through this. It's the same thing with the expert witness work. You have to really rest on your laurels, rest on your preparation that you've done for the case, which is obviously just like with surgery. The most of the work has been done before sometimes you get to the operating room, and then it's just a technical execution. I think it's the same thing with the expert witness work.
Let's talk about your preparations. You're gonna go into a deposition, or you're gonna write an expert report.
Yeah, I mean, first and foremost is just reviewing the case, like knowing it like the back of your hand, right? I think I've been involved with cases that have over 10,000 pages of medical records, right? So some of them very, very relevant to your case, some of them absolutely not relevant at all. So teasing out the parts that are important is first and foremost. And then at that point, I like to, obviously you have your own first clinical impression, and that's where really being open-minded, not, kind of playing devil's advocate. If you were going to do a counter argument to whatever you're going to argue,
sure.
I think it's a good debate technique. I was never involved in formal debate, but you want to kind of be prepared for the flip side if you're going to argue the counter argument, and really looking for data that would support that. And then I go and I do a PubMed literature search. That's where, being involved in research is helpful, because at that point you're playing devil's advocate again, and you're kind of being well versed on the data. Well, they've done meta-analysis of this clinical problem that's involved in this case, and this is where, so it's not just your opinion, it's your opinion based on meta-analysis data, which is kind of like the gold standard, rather than a case study or an expert opinion article, which is kind of the lower rung of the research kind of totem pole.
Sure. You mentioned that sometimes you're kind of overloaded with 16 trillion pages of medical records when you're getting involved in a new case. Do you feel that attorneys over provide you with information prior to a case, and that it causes additional unnecessary billing, because if they give it to you, you're going to read everything they give you? Or do you feel that it's just good for adequate preparation, and the more the better?
I think I would rather have more than less because, yeah, I mean, in an ideal world, a lot of the stuff like that, I would say administrative. The problem is it's a lot of work for the attorneys too, to go in there and go through 10,000 pages of medical records, right? And sometimes, I think just being honest and fair, you can tell the attorney, hey, by the way, this is a lot of records. I don't know if you have an administrative person that wants to go through. I only really need the stuff that's medically related. I don't need the thousands of medical or physical therapy notes, for example, that say the
Right.
same thing. You can summarize and say they've had X sessions of physical therapy, for example, and you take off a couple thousand pages of the report. That just decreased costs, I think, for everyone. But the alternative is that you don't have all the information, which is, I would say, the worst of the two, because you're not adequately prepared heading into the case if you're missing a crucial MRI report or a doctor's note or ER visit. So I would rather have the other problem.
Yeah, sure. Absolutely. With regard to contracts, when you first accept an engagement, do you have
Mhm.
your own form contract that you tend to use, or do you negotiate based on a contract provided by the engaging attorney? And if so, are there any are there any terms that you like to include?
Yeah, I mean, for now, it's just a retainer to start out actually working on the case, making that initial investment. You give me some ideas because I just have a flat fee schedule. And obviously, if a case goes to settlement, you want to make sure you're not adequate, you're going to get adequately compensated for your time. So it's nice
Sure.
to have, if it's a case that's going to be protracted over a course of several months, for example, it's
Sure.
nice to have that open option to bill biweekly or monthly. And that's kind of the learning curve that I was talking about. Obviously, when you're treating patients, it is what it is. You're doing usually a fee for service model. So I have a standard fee schedule that I send to the attorneys, and it's I think like anything else, it's really building that rapport and relationship that you'd hope that if the attorney is seeing this going to settlement, that they give you a little bit of a heads up, like, hey, by the way, you can, because it's one thing if this is all you're doing, but if you're actually treating and you have a busy practice, I do have to make sure I have enough time spaced out in the week to dedicate, because it is really time consuming if you're going to be doing a thorough job on it.
That's an interesting point. How would you say continuing to work in your field advantages you as a expert witness, as opposed to somebody who's just a professional expert witness?
I mean, I think there's something when you're simply just doing this, obviously you get more reps and you get more experience at it, but at least my thought process is that you're in the trenches when you're actually treating patients, and a lot of these cases are day-to-day things that happen all the time in your practice. So when an attorney asks you how often have you treated somebody with this condition, and you say, well, I don't really treat anymore, I think it's a little bit different than, yeah, I saw this in my office yesterday, and this is how I normally go about it. These are the tests that I do. This is how I would expect a reasonable treatment course to be. These are some of the
Sure.
complications that you can have from this procedure. And also, it gives you paints a different picture, because you're not just simply looking at things from a med legal perspective. You're being hired or your job is to give your medical opinion. So if you're actively involved in medical practice, I think it's a little bit more feasible and easier to give that, and then you get the experience of being an expert delivering your medical opinion.
Do you think that it's more persuasive to the jury?
I think so. At least the feedback that I've gotten early on in my career, I mean, I can put myself in the jury's shoes, and if you have someone that's involved in a heavily busy practice, and they're treating the clinical diagnosis that's in question, it's more likely to get their feedback, I think.
Absolutely. Let's move to the more general. What is important? What's meaningful to you about being an expert witness? Why is this an important job besides just paying the bills? Why is this something that's important that people should be doing?
Yeah, it's funny. I was talking about it earlier with some of my colleagues, and you go through all these years of schooling, right? From college, and I think the generic form of why people go into medicine is that you want to help people, right? That obviously gets a little bit more complicated when you come out and you see how the medical system in the United States is a whole different discussion. It's unfortunately physicians are being compensated less and less. The reimbursement rates are going lower and lower, which is unfortunate. I'm in Southern California where the cost, and I have my own private practice, so the cost to run a private practice are only increasing. And what's nice about being involved in this type of work is that you're really involved in kind of seeking the truth. I'm sure that that's a lot of reason why attorneys kind of go into the field that they do, but you're able to provide your years of training and knowledge and your, clinical experience to help kind of bring into light some light into the situation, because it's easy to kind of take something that maybe you don't know much about and run away with it to advocate for your cause. And if you're involved in helping someone who's either on whatever side of the clinical argument there is, really, really providing your medical knowledge. And I also think it makes me a better clinician as well, because it kind of forces me to keep up with the literature. So everything is kind of connected, right? And I really do get enjoyment kind of playing detective a little bit, going through the medical records and trying to kind of help solve a puzzle as to, well, this is what I think is going on. So it is definitely a rewarding part of what I do in my career.
With regard to your relationship with the attorney, what in general makes for a good expert attorney relationship, especially for newer experts who haven't done this a lot, who aren't sure what to expect? What are things that attorneys should be doing when reaching out to expert witnesses, and what are things that expert witnesses should know when getting into the field for the first time?
I think it starts with that initial call when you're getting on the, especially with somebody that you haven't worked with. I think it should be an open door policy where, as you're going through the records, I mean, so at least I would want to know, if I were the attorney, that if you see potential holes in the argument or what they're asking you to maybe opine on, you want to know, like, hey, I think there's evidence of maybe symptom exaggeration in some of these clinical notes, or if you're asked to go through and give your opinion on something contentious, you want to tell them, early on. I don't think you want to be figuring out a month or two into the case, well, I actually think that I'm not going to be able to defend this, for example, or argue for it. That's kind of the opening parts that go into it. And then really, I think the most successful scenarios I've been in is from the very beginning, them letting you know, these are what I think are potential some holes in our argument are. What are your thoughts on it? Is there something that you can address? And really, the lawyers educating the medical professional on the legal side, and then the medical professional educating the attorney on the legal side. Not necessarily to kind of switch roles, but really educate them on each other's roles.
How do you deal with all of the technical jargon when you're dealing with potentially lay people? You were mentioning before that some attorneys may be approaching medical expertise for the number of cases they've done in the medical field, but not everybody will be. The jury certainly won't be, and some judges won't be either. So how do you kind of get across the important technical details without just burying them in a bunch of jargon that they have no idea what it means?
I think the best way is to really talk to them as though you were talking to your patient, which is what I've learned. It's sometimes the most effective way of communicating with them. Is obviously, if someone has a medical degree, you're not going to sit there and kind of make analogies to food or cars or whatever. But I would say that at least one of the things I pride myself on that I've learned from mentors is effective communication. It's essentially telling a story, like anything else. You're a storyteller, and how you go about explaining it within medically reasonable probability is using things that they understand, and trying to communicate with them that same way, right? Like I'll give a common analogy. I use like meniscus tear. I say it's kind of like having a hangnail. If hangnail may not bother you, but if you kind of poke it the wrong way or you dig it into the skin the wrong way, the meniscus can also cause issues the same way. For example, that's when I'm explaining things to a patient. So it's really knowing your information so well that you can break it down into something that's understandable metaphorically.
That's really interesting. So it requires a lot of knowledge to make it simple for people with no knowledge, right?
Definitely. You're able to, I forget who said it, like genius is being able to express things the simplest form possible, right?
That's right.
And it's tough. Yeah, when things get really complicated as they do in some of these, 10,000 pages of records, for example, it takes a lot of work to synthesize it into something that's more straightforward.
Before we wrap up, do you have any last advice for newer expert witnesses out there, or for attorneys who are working with newer expert witnesses?
I would say for people getting into it, I think it can definitely be intimidating at first, especially when you kind of hear med legal together. It can be scary because I think most doctors would think from a malpractice standpoint.
Right.
But I think if you come to it from a perspective like we spoke about earlier, where your job is the same way that we need to educate our patients. That's probably the most important thing that I do. I'm a surgeon, but half the time my job is to educate my patients, not in a paternal standpoint, but really have them understand. So when they're outside of the 15, 20 minutes that they're with you in the office, for example, they're make more informed decision. I think it's the same thing with the relationship you have to have with the attorney. And for the advice for my attorneys is really, outside of you working with somebody who's been doing this for decades, I think there's always room for improvement, always room for growth, always room for effective communication, and just realize you're not necessarily having the same discussion that you would with an attorney, the same way that I'm not having a discussion with a physician.
Sage advice. Thank you so much, Dr. Heyrani, for joining me here today.
Thank you, Noah. Thank you for having me.
Of course, and thank you to our guests for joining me for another discussion at the Roundtable. Cheers.
Thank you for listening to our podcast, Discussions at Roundtable. Our show notes are available on our website, roundtablegroup.com. Subscribe today on Apple Podcasts or your favorite listening apps.